Dementia, Alzheimer's disease. Welcome to our module on dementia and Alzheimer's disease. We will provide you with an overview of these diseases and common challenges to caring for your patients with dementia. You will learn the most common types of dementia, including Alzheimer's disease, common challenges to providing care, creative approaches to challenges. Dementia is a general term used for loss of memory, language, problem-solving, and other thinking abilities. The symptoms for dementia tend to occur very slowly and become more severe over time. Usually, by the time a patient receives a diagnosis of dementia, they have already been experiencing noticeable symptoms and challenges. According to Alzheimer's Association, these difficulties are severe enough to interfere with daily life. There are over 100 types of dementia. For today, let's start by discussing the three most common types. Alzheimer's disease. Alzheimer's disease is the most common form of dementia that affects memory, thinking, and behavior. This is caused by tangles and plaques forming in the brain. Patients under 65 years of age with Alzheimer's are said to have early onset Alzheimer's disease. For all patients, Alzheimer's worsens over time and can either be in the early, middle, or late stage of the disease. It progresses from no symptoms to mild cognitive impairment, or MCI, then to mild, moderate, or severe dementia. There isn't a cure yet, but there are medications that slow the progression of symptoms. The most common symptoms associated with Alzheimer's disease are forgetting newly learned information, confusion, mood changes, and behavioral changes. Vascular dementia. This is the second most common type of dementia. It's also called vascular cognitive impairment. Vascular dementia is a change in thinking skills caused by a reduction of blood flow to the brain. Various conditions can cause it, like a stroke or cardiac diseases. Vascular dementia can also occur alongside Alzheimer's or other forms of dementia. The most common symptoms are memory loss, trouble speaking, difficulty with word finding. Medications used to treat Alzheimer's disease can be used to manage symptoms of vascular dementia, as well as treatments for the underlying diseases that cause it. Dementia with Lewy bodies. This form of dementia results from clumps of protein in the brain. It is closely related to Alzheimer's disease and Parkinson's disease. The most common symptoms are changes in thinking and reasoning, movement difficulties, delirium-like thinking or hallucinations, and sleep disturbances. There are medications available to help manage these symptoms. Each of these forms of dementia are best diagnosed by a neurologist. A patient will receive comprehensive cognitive testing and imaging to diagnose which type or types of dementia they may have. Early testing can help slow down the progression of dementia. Testing may also uncover other causes of memory loss that are due to other diseases. Many times, caregivers and family members may notice signs of dementia even before the patient does. Sometimes, families think the patient's forgetfulness or confusion is just part of getting older. Understanding the early signs of dementia is important for caregivers so that you can report changes and concerns to the healthcare team. Check out this worksheet from Alzheimer's Association that helps you recognize the top 10 warning signs of Alzheimer's disease. and fill it out with your patient's corresponding symptoms. Now that you know a little bit about the most common types of dementia and signs of Alzheimer's disease, let's talk about some common challenges and creative approaches to providing dementia care. If you are caring for a patient with dementia, you may experience some of these situations. In all of these situations, your role as the caregiver is to stay calm and supportive and to keep your patient safe. When these situations happen, you can try some of these approaches. Challenge. Your patient is agitated or upset due to memory loss. Approach. Redirect the patient either by physical movement or mentally switching to another focus. Go outside with your patient. Fresh air, sunlight, and other distractions can help change their focus. Afterwards, avoid discussing the episode with them. Just move on. If your patient can't remember something in the short term or from long ago, avoid repeating questions, quizzing them, or reminding them about things they cannot remember. By calmly redirecting them to another activity, the patient has a chance to calm down and refocus. Challenge. Your patient is confused or forgets who you are. Approach. Reassure the patient that you are here to help them. If they mistake you for someone else, such as their daughter, go along with it to prevent additional confusion or frustration. If they forget who you are, you can feel out how to respond by casually reminding them of your name. Gentle touch can be calming and reassures the patient that they are okay. Singing songs they know can also help. Singing activates different parts of the brain and can often help patients with dementia become engaged again. Challenge. Your patient is wandering in and out of the home. Approach. Walk with your patient, which may help them rest later. For patients with dementia, keeping them safe is a priority. If you cannot be with them all the time, use chair and bed alarms to alert you when the patient is walking. Wander guards and door alarms can also alert you if they try to leave the home unattended. Remember, a caregiver needs to be in the home to respond to these alarms. If a patient with dementia wanders, they may need someone to assist them at all times. Work with the healthcare team to determine if they require more assistance or a safer place to live. Challenge. Your patient is angry and unable to calm down. Approach. Respond to them in a calm manner and don't try to argue or reason with them. Offer a calming task or do something they enjoy. Going for a walk, having a snack, watching TV, talking to a loved one, or looking at family pictures are all approaches to try. If you know what caused your patient to get angry, try to avoid repeating it. Allow the patient time to calm down, but don't leave them unattended. Talk with the healthcare team if you need to. Challenge. Your patient refuses to eat at regular meal times. Approach. Allow your patient to be in control as much as they're able, and be willing to flex meal times as needed. If it encourages them to eat more, try 3 to 5 small meals per day. If they refuse meals, offer them healthy snacks throughout the day and encourage them to stay hydrated. Try to minimize sugar in their diet to prevent blood sugar spikes and dips. These can also affect their mood. Avoid arguing with the patient about when and how much to eat. Support their choices when you can, while keeping nutrition in mind. Some additional tips that can help you as you care for your patient are: Speak to your patient as an adult, never as a child. Provide choices whenever you can to allow your patient to feel they're still in control and respected. Take advantage of times when your patient is alert and encourage an activity they enjoy. Maintain consistent routines in your patient's day-to-day activities. Stay calm and patient as you care for your patient. Caring for a patient with dementia can be challenging, but also very rewarding. As their disease progresses, your support and knowledge of their needs will mean more and more to them. Take comfort in knowing that you are providing them with the care and safety they need. Thank you for attending our learning module on dementia. We hope you have gained a deeper understanding of how to care for your patient with dementia.